In the modern world, staying in good health can be a real challenge. We are at risk of new diseases and deficiencies of relevant vitamins. Today, let us look at vitamin D. Why is vitamin D important? Let's hear from a specialist.
I think you're going to be quite blown away how broad vitamin D affects the different organs, the different tissues. Typically, when we think about vitamin D, we think about bone, maybe the immune system, but actually you're going to be quite surprised on the different areas that vitamin D affects. It's actually quite fascinating. Now, vitamin D receptors are in almost every single cell, if not every single cell of your entire body. And because vitamin D is a fat-soluble vitamin, it penetrates the membrane and goes right to the center of the cell, the nucleus. Okay, so it has huge effects over that cell. And in reality, though, vitamin D is not really a vitamin, it's a hormone. If you're deficient in vitamin D, you're not going to sleep at night. Vitamin D helps the circadian rhythm. It helps the sleep centers in your brain. And that center is called the suprachiasmatic nucleus. Not that you need to know that, but it's kind of a cool word. So whether you have sleep apnea, or you just have insomnia, or you get up in the middle of the night because you have high cortisol, like at 2 o'clock, vitamin D can greatly help you. And I would recommend taking vitamin D before bed. And then we have your mood. Your mood is greatly influenced by vitamin D. Think about in the winter what happens. You have seasonal affective disorder. You have depression. Why? Because you don't get the sun, you don't get the vitamin D, and then you get depressed. You get the blues. You're sad. I mean, think about how important vitamin D must be to your body if you can convert sun through your skin and make your own vitamin D from the cholesterol lining in your tissue. I mean, you don't need to eat anything to get vitamin D. You just need to expose your skin to sun. So if you have anxiety or you're especially depressed, you need to take more vitamin D, and it will definitely raise your mood. Whether you have stiffness, pain, inflammation, you need vitamin D because vitamin D is a natural anti-inflammatory. It gets rid of pain. And it's especially important in all the itises like arthritis, both rheumatoid and osteo.
Of course, there are even more benefits, such as prevention of breast, ovarian, prostate, lung, colorectal and melanoma cancers, immune enhancement and blood pressure regulation. So how much vitamin D should you take? This issue is quite complicated.
Well, we have some guidelines on that from a government panel that was set by the Food and Nutrition Board of the Institute of Medicine. This is a group of experts who review the evidence related to how vitamin D influences health. And they set what's called the dietary reference intakes, or DRIs. So, based on their review of the literature, they've set the requirement to protect bone health. They think the evidence is strongest based on how vitamin D influences bone health. There's other effects that vitamin D can have on other chronic diseases, but at this point they didn't think the evidence was strong enough to set a requirement. When they finally finished their review of the information, they set requirements on a number of different age groups and for special populations, for example, breastfeeding women or pregnant women. And they set the requirements to meet the needs of 98% of the population. And this is done with the assumption that there is no sun influencing your vitamin D requirements. We have a table for you to show you the vitamin D requirements. And this is, again, based on bone health. And if you look at this, you'll see that most of the groups, for example, children, teens, and adults up to the age of 50, have a vitamin D requirement of 600 international units per day. And this is also true for pregnant and breastfeeding women. However, when you look at kids who are infants, from birth to 12 months, we have a slightly lower requirement of 400 international units per day.
Easy way to check the vitamin D level is taking a rapid test, for example Barclay Health Vitamin D Rapid Test. It is above 90% accurate and the result is available within 10 minutes. Taking the rapid test can be the first step to diagnose or exclude vitamin D deficiency and use potential supplementation. Of course, there are more self-tests on offer, but we will tell you more about this in the following episodes.